Good morning, good afternoon, good evening. Live from Toronto, this is IFA's Global Cafe. My name is Bruna Swerks. I'm Director of Communications and Strategy at IFA, and I welcome you to the session. Please keep in mind that this session is being recorded. We're also live streaming it on our Facebook channel. I will post those resources later in the chat box. Please use the chat function on the bottom of your screen to pose any questions. Our moderator, Katrina Buzanis, will address them today later at the Q&A portion of our session. We're going to have a very lively discussion here, and I hope you enjoy it. Katrina, the floor is yours.
Thank you, Bruna, and good morning, good afternoon, good evening to everyone, as Bruna said. So my name is Katrina Buzanis. I'm a program manager at the International Federation on Aging, and I'm pleased to be with you for our Global Cafe this Friday. So 2021 has marked the beginning of the United Nations Decade of Healthy Aging, which represents a concerted effort across diverse stakeholders to improve the lives of older people and promote healthy aging throughout the life course. Still at the outset of the decade, now is the time to explore strategies which allow older people to do what they have reason to value, with a focus beyond longevity to ensure strong health and well-being. Social connection and community integration are proven factors which impact health and well-being. However, older people and many others are too often isolated, experiencing detriment to their mental health, which has been particularly highlighted throughout the COVID-19 pandemic. So joining us today to discuss the impact of social integration on longevity and healthy aging is Dr. Claudia Trudel-Fitzgerald. Dr. Trudel-Fitzgerald is an assistant professor of psychology at University de Quebec at Trois-Rivières and a researcher at the Research Center of the Montreal Mental Health University Institute in Canada. She is the research chair in social disparities, stress-related coping and health, and also an affiliate scientist at the Lee Kam-Shung Center for Health and Happiness at Harvard University. Dr. Trudel-Fitzgerald is interested in understanding how psychological and social factors such as depression, optimism, and social integration may influence the maintenance and decline of physical health as well as longevity. She is also consultant on several studies in Canada and the US that aim to measure psychological well-being. So Dr. Trudel-Fitzgerald, I hand the floor over to you.
Thank you very much, Katrina, for this nice introduction, and thank you to the team for planning this event this morning for me, regardless of the time zone for you. So good morning, everyone from Montreal. I'm really pleased to be here today and present some of my work on social integration and how that can impact physical health over time, and hopefully have a lovely discussion afterwards about these different constructs and factors. So when I did receive the invitation, the IFA were already interested in talking about healthy aging and longevity. And it made me think about all the recent shift that is happening in research. So as you might know, for many decades, for a long time, researchers have been really interested in trying to better understand the factors that could drive chronic disease development, mortality, and all those more bad outcomes, if I can say. And this is really valuable, don't get me wrong. It's really important to try to understand what increases our risk of developing certain chronic disease over time, what makes life shorter. But increasingly, researchers are more and more interested in trying to understand what could promote a healthy aging and a longer life. So we're switching a little bit the focus here, or bringing a new focus in research over the past few years, trying to think of protective factors for health. And this came about because over time, people realize that the absence of negative factors does not necessarily equal the presence of positive factors. So for instance, if you're not depressed, that doesn't mean that you're happy. It doesn't mean that you're satisfied with your life. Similarly, if you're not socially isolated, it doesn't mean that you feel well surrounded, and it doesn't mean necessarily that you have really nourishing relationships. So there is really a lot of research that is developing and led looking at these more protective, more positive factors that could influence health and these more positive health outcomes. So thinking of how we can live longer, how we can live in a better health, and why not, could we be exceptional agers and reach 100 years old, for instance? And so part of these determinants of health have been the social connection, the social environment. And people have been really interested in social connections for a long time because, you know, it's part of the human experience. We're not alone on an island. We have people around us. That could be our family and friends, but that could also involve people that you will meet one time at the grocery store, at the movie theater, what we call weaker ties. But these are also part of the human experience. And together, we're talking about social environment and social relationships. And obviously, during COVID-19, Katrina said it well, it's particularly important because our relationships have been switching a little bit how we engage with people, the kind of activities we're doing, if we want, for instance, to maintain social distancing, as they say, and respect the public health guidelines. So it's a topic that is really important these days. It's been for a long time, but it has a particular focus with the COVID pandemic. So in the research thus far, researchers have been thinking of social connections in a couple of different ways. So I thought I would present them today before getting more into the research that my colleagues and I have been conducting over the past few years. So one way of thinking about the social connections is the social network. So this is really the structure of your social environment. It's really quantitative if you want to think about it this way. So we will look at whether people have close friends, close family members, to what extent they engage in weekly activities that could be religious activities, community activities, you can be engaged in volunteering, that kind of thing. And then with these kinds of measures, we'll be able to say to what extent someone is more or less socially integrated. So on one end of the continuum, the people will be more socially isolated, and progressively they can become more and more socially integrated. And as I said, we'll look at different facets of their social environment, but it's really about the structure and the number of relations that people have in their life. So that's been one way of thinking about the social environment. The other way is the social support. So now we're talking about what brings the relationship to you or to the person. So you could think of a close person to you or close friend or a close relative. When you don't feel that well, you go to that person. So that person will provide emotional support. This is the shoulder you will be crying on. And this is where you go when you need to vent about a specific situation that triggers you. You could have another person in your social environment that will be really helpful. So that person will provide more informational support, for instance. So could answer your question about how do I go to this place, or could you help me go to the hospital or my medical appointment? So it's more like useful in terms of supporting you. It's not necessarily emotional, but that's another way of providing social support. A third way researchers have been thinking about the social environment, it's really the quality of the relationship. So here we're not talking about the number of people in your network. We're not talking about the type of social support, but rather we're trying to qualify, give the color. Is it a relationship that is nourishing for you? Or on the other end, it's a relationship that brings some strain. And that could happen. We can have people close in our family environment or in a group of friends. And with this specific relationship, it's a little bit more stressful, or it's not always as nourishing as other relationships that we can have. So these have been the three main different ways scholars have been thinking about the social environment, and I've been studying social environment in research. But I could not go on with more specific results about healthy aging before talking about or without talking about loneliness. So we've been hearing a lot about loneliness. It's been a focus of some news also in the context of the pandemic, while we're a little bit more restricted in the kind of activities we can do. And loneliness, unlike these other facets of the social environment that I just presented, it's really about a feeling. So we feel lonely. So someone could be socially integrated. So in terms of the number of relationships, in terms of the structure of the social environment, that person has many connections, but still feel really lonely. On the other hand, someone could not have a big network or not that many relationships, but these relationships are really nourishing. And then as a result, that person does not feel lonely. So in other words, the feeling of loneliness does not necessarily equal the number of relationships. It's something really different, and it's really about how we feel in relation to the different relationships we have in our network. So in terms of healthy aging, so why do we study the social environment and in relation to physical health, healthy aging, longevity? Well, you can imagine that a lot of research for the past decades have looked at all these different ways of characterizing the social environment in relation to mental health. So you can imagine if you have close relationships that are nourishing, you don't feel lonely, that's good for mental health, right? So you feel better, you feel less depressed, it helps you cope with different challenges. So there is a lot of research showing that. But over the past decade, people have been increasingly interested of looking at physical health. Is it also beneficial for physical health? So one of the study that my colleague and I did a couple of years ago, so it was published in 2019, and I think the team will maybe share the link in the chat box, and I'm happy to circulate more information after. We were interested in looking at the relationship between the social network. So if you remember, that's really about the structure and the number of relationships one has in his or her environment, whether that would predict lifespan. So do people live longer? And do people are more likely to reach exceptional longevity? And I'll come back in a few seconds on what is exceptional longevity specifically. So we use data from the Nurses' Health Study. This is a really large study that has been going on for a while in the US. It's actually over 100,000 women who have been completing questionnaires since the 1970s. So we have a lot of information on these women. And they're still participating in the study. We're really grateful for that. And so they're providing information still nowadays. So we're able to track them over time and see how do they do in terms of mental health, physical health, chronic disease, etc. And so in this specific study, they completed a questionnaire. So these are different questions, and they say to what extent they have a number of relationships. And more specifically, we had information about whether they were married or not, divorced, separated. We also had information about the number of close friends, the number of close relatives, and to what extent they were participating in religious activities and other type of activities. So that could be volunteering. And that was collected in the 90s. And then we tracked them for 20 years. And we were able to see whether their level of social integration was associated with their lifespan. And what we found was really interesting. So we found that compared to women who were highly isolated, according to this questionnaire, women who were highly socially integrated, so they had a larger network, more relationships, they had up to 10% longer lifespan. So they did live longer than their counterparts. And this is when we compared the extreme groups, right? So the highly socially integrated compared to the highly socially isolated. We found these associations regardless of other factors that could be important. And here I won't go into the details of the statistical analyses, but in a nutshell, what we did is that we took into account other factors that could explain this relationship. So we made sure that we control, this is how we call it, we control for factors such as age, level of education, whether women had some chronic disease. So many factors that could impact longevity. Actually, we control for that to make sure that if we found an association, it's really because the social network is important. So we found these associations regardless of these other factors. And what was also really interesting is that we found a gradient. And research, we'll call this a dose-response relationship. What does it mean concretely? It means that it's not only the highest level of social integration that is important. In other words, women who were moderately integrated, so not the highest level, but still more integrated than other counterparts, they also saw a benefit on their lifespan. So they were also living longer than women who were highly socially isolated. So that was the first set of analyses that we did, but also we wonder whether social network could be important to be exceptional agers. What is exceptional agers or exceptional longevity? Well, in this study, we defined it as surviving until 85 years old. That could seem a little bit arbitrary, right? Why 85? Well, in the US, 85 is slightly more than the average life expectancy, but at the same time, it's not too rare to be studied. For instance, if we were to take 100, maybe it would have been a little bit more difficult because less people will reach 100. So we did the same exercise and look at whether the social network of these women or the extent to which they were socially integrated would predict the likelihood of being exceptional agers over the course of the study over 20 years. And we found that women were highly socially integrated, so the highest level, they were up to 40% more likely to survive until past 85 years old, which was pretty impressive. And once again, in these analyses, there was this gradient effect. So the greater or the greatest benefit were for women who were most socially integrated, but women who were, for instance, moderately socially integrated were also more likely to reach 85 years old compared to women who were highly socially isolated. So the benefit was there. It was just the proportion or the percent was a little bit smaller. And again, we found these associations after taking into account plenty of third factors that could explain the association. So regardless of the age of the women, regardless of their level of education, income, their health status, we saw these associations. If you remember, I said earlier that when we think about social network, we're looking at different dimensions. So we're considering marital status, we're considering close friends, close relatives, and also to what extent people engage in different activities that could be religious or non-religious. So one question might be, well, is it the social network that is really important, or it's one of these different dimensions that is really driving the likelihood of living longer? And so we looked also at all these dimensions separately, and it seems like they're kind of all important. They all play a role in longevity. So marital status seems to be important as much as having close friends or close relationships. So that's a good news, because it means that even if you don't have that many maybe close friends, but you're married, or conversely, you're not married, but you have close friends, you can potentially see these benefits nonetheless. So that was the study I was referring to that we published in 2019. And in this case, we were really looking at longevity marker. But then the $1 million question is, well, it's good to live longer, but is it worth it if we don't live in health, right? So we want to promote healthy aging as well. And for that, or in this mindset, if I can see, some of my colleagues looked at the relationship between social network and the likelihood of being healthy agers in the same group of women. And so in this study, they define healthy aging as not having or not developing chronic conditions. So we're talking about, for instance, cancer, heart disease, and these type of more major chronic conditions. People to be healthy agers need to not have any cognitive impairment. So that was another element of the definition of healthy aging. And then they need to maintain intact physical function. What does that mean? They can do their daily activities. They can walk when they need, go up a flight of stairs, etc. So their physical functioning on a day-to-day basis is optimal as well. And so they did the same exercise looking at what women answered on the social network questionnaire and look at whether their level of social integration was associated with the likelihood of being healthy agers, so maintaining this optimal physical health over time. And similarly to our study, they found that compared to women who were highly socially isolated, women who were highly socially integrated, so the highest category, they were up to 34% more likely to be healthy ager. And we tracked them for many, many years. So over time, they maintain good physical health, good cognitive health, and physical functioning. Again, in this study, they saw this little gradient. So even if you're not highly socially integrated, a moderate level of social integration was also beneficial or somewhat increased the likelihood of being a healthy ager over time. And these associations, as we did in our prior study, were maintained and they were seen after my colleagues controlled or adjusted or took into account different third factors that could explain these associations. And these studies are really promising in terms of living longer, living healthier. There are a couple of other studies in different populations that have looked at these associations. And the idea is really that social integration or our social network, the structure around us, could be beneficial for longevity and for healthy aging. Then one of the questions is, how does that work? What are the mechanisms that could explain the relationship between our social environment and the fact that we live longer? And there are a couple of different, we call them pathways or different mechanisms that could explain these relationships. One is the lifestyle. So we suspect that people who are more socially integrated, they're probably more likely to engage in good health behaviors. So for instance, they could have in their network people who participate in weekly walks in the park, so they will join them. They could have a social network in which there's no smokers, so they will be more likely to stop smoking if they already smoke or not engage in smoking if they're a current non-smoker. So they can engage in healthier behaviors. We could also think of the type of food people eat. And when we're surrounded by people who eat fast food, we're more likely to engage in a similar behavior versus if your network promote healthier food, then your intake in fruits and vegetables is probably going to increase a little bit. So that's one of the mechanisms that could explain why people who are more socially integrated are more likely to live longer, be exceptional ager, and age in health. A second pathway is all about what's going on here. So really our psychological health. So we suspect that people who are more socially integrated, they cope better with stress. So if you have people around you and then you're facing a stressor, and when we talk about stressor, it can be many, many things. It could be living in a pandemic. I think everybody can relate to that these days, but it could also be being late for an appointment, getting in an argument with your spouse or with your kid. It could be missing the bus if you're running after it. So it could be many different things. Some are more minor stressors, some are more major stressors. But regardless of the intensity of the stressor, we suspect that people who have a greater network and are more socially integrated, they are better able to cope with these stressors because they have people to support them, people to help them see a stressor in a different way or help them manage the situation. Remember earlier, I was mentioning the example of if you have a chronic disease, perhaps some people in your network will help you go to your appointment, drive you, take notes while you're at the physician office, etc. So that's one way social integration could help. We also suspect that people who are more socially integrated could be a little bit more optimistic, and that could be the cause or the effect. But essentially, if you have people around you that help you do your daily life, maybe that increase your optimism. And when you think about life per se in general, when you think about life in terms of your physical health, And then we know from various research, our group has done some research on that, but many other research groups, that optimism is good for health. So what is optimism? For those of you who are less familiar, essentially is to see the glass of water half full rather than half empty. So it's seeing the life with a little positive spin, if I can say, without going into the extreme. So we don't want to necessarily favor someone seeing the life as everything will be fine and there won't be any problems. So that's the extreme optimism, and that's not necessarily good for health. But a healthy dose of optimism is favorable. So we believe that having a social environment, a social network, help people be a little bit more optimistic. And then that could be one of the mechanisms explaining why socially integrated people live longer and healthier. And then the third pathway, or the third mechanism, is everything that goes into under the skin. So really the biological processes that are important for long-term health. So there's research looking at whether people who are more socially integrated, for instance, have healthier levels of blood pressure. So that could be one way it's important for long-term health. It's also possible that people who are more socially integrated, they have lower level of inflammation. So all these biological processes, everything that goes under the skin, could be influenced by our level of social integration. And then in the long run, you can see that this is important for longevity and healthy aging as well. So these are the different ways we're thinking that the relationship may work. There, as it's often the case in science, there are probably other pathways that we don't know yet. But this is how we understand the relationship between social integration and longevity and healthy aging thus far. And so, as you can see, I could talk for a really long time about this body of research. It's really a fascinating area, but I want to make sure we have time for questions and discussion. So I think I'll stop here, and then we can open the floor and chat more about this topic.
Great. Thank you so much, Dr. Trudel-Fitzgerald. And the study that you mentioned is quite an impressive piece of evidence indicating that social integration really has such a strong impact on not only longevity, but also maintaining function, which is something that we're always kind of talking about here at IFA, is not beyond longevity, but also healthy aging and kind of giving purpose to life in addition to years. So there's quite a few questions that we've gotten. I want to start by speaking a little bit about COVID-19, which there were a few comments, including one by Shmuel and I think a couple of others. Just thinking about the impact of COVID-19 on social integration and perhaps the idea that COVID-19 has shed light on things that, have kind of been happening in the background for a while now, with, people feeling particularly isolated and suffering as a result of that in their health and in their longevity. So I was wondering if you could, comment a little bit on that, and perhaps, if you feel your research has also kind of contributed to shedding a light on something that has been kind of long overdue.
Yeah, that's a good question. And, we cannot talk about the social environment without talking about the pandemic, because it's so vivid, we're right in the midst of it. And obviously it did impact our relationship. It still continues to do. So in terms of data per se, I'll talk about the Nurses' Health Study, because a lot of my work is with this research. We've been collecting data during the pandemic among these women. As research takes a long time, we're analyzing these data. So the results will come in a few months, in a few years. But more generally speaking, I think that in the context of the pandemic, our relationships have changed in terms of frequency, in terms of quality sometimes. If we think of social support, it's harder to maybe help someone because we're trying to be socially distant. And I think that what the pandemic has brought us as insight is really to be creative, because the social environment is part of the human experience. We're craving for relationships in different ways. Some people, when I was talking about loneliness, I was referring to that a little bit, but some people are really happy with only a few relationships because they're really nourishing, and other people are more extroverted. They need to connect with more other folks to feel nourished about these relationships, and both options are fine. It's really about how we feel in those relationships. But the pandemic has really challenged this context, because we've been restrained and stayed at home, or when we see people, we cannot be as close. It's as simple as giving a hug to a loved one. For a while, we were unable to do that, and that's been hard and saddening. So I think what we've learned is to be creative. So how can we maintain our relationships in a context where at times we can see each other, and depending on the waves we're going through of the pandemic, sometimes we cannot. So people have been really making the most of the summer, depending on where you are in the world. But I know in the province of Quebec, and even when I was living in the US at the beginning of the pandemic, when it was summertime, everything was easier. So we were gathering all this social energy we could get, and then it was easier to go through the winter season, but benefit from that warmer weather to see people outside and do some gathering that are socially responsible and socially safe. We're more and more using all the technology. And of course, we can do those FaceTime or those Skype meeting, which is essentially talking with people you care about. But I've heard people doing really nice things with this electronic connection. So for instance, attending a live concert, but with someone on FaceTime. So you're not necessarily talking with the person you're connected on FaceTime with, but both are attending a concert that is live stream, and then you can chat about the concert after. So of course, it's not exactly as going together to the concert, but it's a creative way of trying to bring back activities that we were doing before while being responsible and careful in the context of the pandemic. I had other folks telling me that they went back to writing letters, which is a habit that obviously we lost over time, or at least certain generations don't do as much. And personally, I really like receiving a letter or a card by mail. So going back to some habits that we lose over time, then in the context of the pandemic could be recreated, and that could be really nice. And these are more like direct connection, but we know that the social environment and social relationship can be manifested in other ways. So we cannot necessarily drive our brother or sister to the medical appointment because we need to be more socially distant, but maybe we can do something else. Maybe we can enroll that person in a home delivery meal. So there are other ways to provide social support while respecting the social distancing in the context of the pandemic and get the benefit of our social environment.
Yeah, I think certainly people have gotten creative, which is very nice to see. There's not just one way to kind of have your social network. It seems to be quite more branched out now, which I think is hopefully a positive thing. Hopefully that's something that people keep writing letters and things like that. So there's a question from John, which I hope you don't mind if I add to it a little bit, John, but that asks, this study was particularly in women that you've spoken of. So John has asked if there's any studies in men, but I'm also curious if there's any sort of gender differences that we can think about in terms of, your social networks, your social integration, things like that.
Yeah, absolutely. That's a great question. So we have a parallel study only in men that are health professionals. So we were thinking of doing a replication of that study to see if we have the same results. But upfront, it seems like we could get the same results. There are other studies where they conducted the research and looked in mixed groups, and then they did analyses only in men and only in women. And typically we see similar benefits. So more integration, better relationship typically is better for health. We know that married men, we've heard that married men live longer. when they're in that relationship than not. So it seems like there is a benefit for men as well. That being said, the function of these relationships might be different. So if we think of social support, for instance, we know that women will use social support, the emotional type, for coping with stress more than men. So when women are facing challenges in their life, different stressors, they're more likely to go and see a friend or a relative and say, hey, I'm dealing with something really hard. Can you help me walk this through, or can I vent? While it seems like men are less likely to do that. So there are some differences in how men and women use their social network, their social environment. And when we start looking at these little differences, it may relate a little bit differently with health and well-being and longevity, but overall it seems like men get some benefit of the social integration as well. And this comment also makes me think of something that I need to mention about the Nurses' Health Study, is that the vast majority of these women are white. So another question when we think about people differences is whether we see these associations in other racial and ethnic groups, which is a really important question as well. And typically we see benefit as well. So the highest level of social integration, for instance, has been found to be associated with longer life, lower risk of mortality in other populations, such as Black and Asian individuals. That being said, again, there might be differences in how people connect. We know that for certain racial or ethnic population, the relationship are really more experience in the context of religion, while for other people, it's more experience with like the closest family members. So that's really ways that will be interesting, or perspective or avenue that will be interesting to study in future research, looking at these differences across subgroup of the population.
Yeah, that's great. Thank you so much. I think it's interesting to note some of those differences and perhaps some of these kind of socially constructed things that influence integration between men and women and things like that. So thank you very much. I would like to call on Matthias. I see Matthias has a question on kind of dwelling and social integration. Would you like to unmute and come forward?
Hi, good morning, everybody.
Hi, good morning.
So you want me to ask the question? I was wondering, because there's a lot of talk today about giving care at home so that people can stay at home as long as possible, because that's really what people want, or at least the vast majority of elderly people. But I'm wondering, is there not maybe a bit of a catch-22 in that if you stay a long time in your traditional home, you're going to lose opportunities for socialization, and maybe that could make in sort that you would be less socially integrated. So I'm wondering if there's any studies that look at where people live and how this has an impact on their social integration. And it's probably, the concept of single home versus condos, or, elderly people's residences, where they might run into other people more frequently because there's just a higher density of people living in the same area.
This is a fascinating question. Thank you for asking that. I am not aware of studies that have done this, but I'm sure there are some work out there looking at this very specific question. And again, it would be interesting to look at where people live per se. So whether they're lonely in their home versus in a place with other elderly, for instance. But again, that's like a marker that is more structural, but they can still have really nourishing relationships through different connections that they have. So I like that question because I think it brings an aspect that I haven't talked today, but also how complex studying this question might be. And it also makes me think of the people who are involved in individuals who are aging at home. So we can think about caregivers, which is another whole area of research. But this is a social relation that is really specific, right? You're caring for people for a person who is aging, might have chronic disease, and it puts a lot of stress. So it's a good relationship. It's typically a close relationship, but that brings some stress. And there's been a lot of research looking at how that could impact health as well. But yeah, definitely a good research question. So I'm looking forward to either read on that or maybe suggest my colleague to look more into this.
Yeah, thank you. Yeah, it's interesting. You know, you can kind of see it both shake out kind of both ways. You know, it's perhaps first and perhaps it's almost person dependent a little bit. And depends on the social networks that are kind of already existing. I don't know. So lots of interesting questions. I think we have another question from Gail, thinking about staying in the workforce. Gail, would you like to come forward and pose your question?
Can you see me? Can you hear me?
Yes, we can hear you great.
So in DC, we have 3 big employers. The biggest is the federal government. The second biggest is the universities. The third is DC government. And all of them are showing growth in people who are over 65 working in the jobs that they were in or taking different jobs. And I'm curious to hear if there are studies about people who stay in the workforce and longevity.
Great question. I don't have a specific study that come into my mind while I'm listening to your question, but what it makes me think of is the concept of purpose in life. So I don't know if you heard about that. Katrina even alluded a little bit to this earlier. But what we suspect is that when people are retiring, some people have like plenty of ideas of what they want to do next, but some people it's a really big shift because they've been engaged in the same job or a couple of different jobs over their lifetime, but all of a sudden they don't have something in which they're involved and engaged with. And that's a major shift that can be difficult for some people. And for many people, it's one of the main purpose in life is to work. And when they do retire, to your point, because they lose this sense of purpose in life, that could impact health outcomes over time, longevity. There is a large body of literature showing that purpose in life is good for health. It promotes longevity, lower the risk of different chronic diseases. So when we were talking about mechanisms or factors that explain relationship, that might be one. So when people do retire, they lose some sense of purpose in life, and that could be detrimental for health. But as I mentioned, that could happen in one scenario, and in another scenario, people have been engaged in a work job for a long time, and then when they retire, they have so many ideas. I want to travel, I want to see my grandkids, I want to build this house by the lake, I want to engage more in physical activity now that I have more time. So if they develop other reasons to live, other purposes in life, they might not see that detrimental impact of retirement on health. So it can go in different ways depending on how people see and experience the retirement stage. Hope that answered the questions.
Thank you so much. I see just a comment, just looking through the chat, there's been quite a few comments, but there's a comment from Sharon on aging in place and mentioning NORC becoming a bigger issue to make those social connections. So Sharon, I was just wondering if you wanted to pose your comment and just share a little bit more on what you were kind of referring to.
Yes, so we know that 91% of people in Ontario surveyed in the last year want to age in place, and that there's been an increase in naturally occurring retirement communities. So what we are hoping people can do in age-friendly cities and communities is start to build those naturally occurring retirement communities around housing so that older adults can age in place, but also can access the social connections and, if necessary, the medical and other types of help they might need. Does that help?
Yes, I was just curious, the naturally occurring retirement
communities have become a bigger issue in Ontario. They started out in and around Toronto, but it has spread. And there is a website under NORC Toronto. If you look that up, you'll see their research. They also have some micro grants available if people want to start a naturally occurring retirement community.
Thank you. Yeah, thank you so much for sharing that. I just think that's kind of an interesting idea of sort of maybe maintaining a social network. I don't know if you would like to comment on that at all, Dr. Trudel-Fitzgerald.
Yeah, it's really interesting to hear about these movements that are going on. And you know, there is increasing research showing that these some weak ties, what we call weak ties. So these are not your close friends and close family members, but people that you'll see really irregularly, or you don't have like a really close relationship with them, could be as important for our health, generally speaking. So mental health, physical health, just in a different way. So when I listened to your comment, it made me think about that, like these naturally occurring communities where you'll end up living and seeing people that you don't necessarily have a really close relationship with you, but they might still be really important in your social environment and consequently on your health, broadly defined.
Yeah, I think it's interesting. Jane, Dr. Jane Barrett has just put a comment in the chat as well that we're really talking about creating an environment that enables older people to kind of have purpose, that sense of purpose, as you were kind of mentioning, and do what they have reason to value, as we say. So I think there's just another question that I wanted to ask myself, which is really about kind of operationalizing some of the research that you've spoke about. And so we're always thinking through maybe a bit of a policy lens, and we've seen some of these ideas sprouting up a little bit with certain, efforts in government to address loneliness and social isolation, and even in more traditional health practices, I suppose, like this idea of social prescribing, that sort of thing. Mm-hmm. So I wonder if you have any thoughts on how to operationalize some of this in terms of policy and practice.
Yes, this is a great question. All of this research on social determinants of health, as we call it, is so interesting because these are things that we can modify. So it's not like a gene, although maybe in a couple of years, there will be many changes that we can do on the biological standpoint. But for now, they're more modifiable than risk factors that we know from the physical standpoint. But still, some of them are not that easily change, or it takes, big efforts and large changes from the structural standpoint to be able to bring those changes. But I think there are a couple of ways that people have been starting exploring. I think those naturally community resources that we were just talking about is one way of supporting more social connection with people that won't necessarily become your best buddy, but people that will be in your environment and can contribute to those weaker ties, and that I've been talking about. There is also, and now I'm blanking on the country, but a country and the spike of the pandemic that created the Ministry of Loneliness and a hotline for loneliness. So if you remember earlier in the talk, I said loneliness can be experienced by many people, and it's independent of your social network per se. So you can have a lot of people in your network, but still feel lonely. And that has been implemented really as a public health policy. And they saw that people, when they surveyed people use that hotline, they did call, they feel less lonely, they felt happier after the setup of this service. So it seems like it's been really beneficial. So that could be one way of supporting people. And then I think in the context of the pandemic specifically, there are so many, hot press media talking about the physical distancing, the washing hands, the wearing masks. I think the policymaker could take that opportunity to have one or two words every time about how to maintain your social relationships. How can you be creative and foster connections with people you care about despite these different regulations? That could be a really nice opportunity to just, take the mic. You're already talking about other important physical, behavioral recommendation, and might as well have a few words on how we can nourish the social experience despite this public health challenge.
Yes, thank you. And I think there's kind of a couple comments in the chat that kind of echo that developing community resources, things like that can go a long way, as well as, I think making that shift to prevention as opposed to kind of these curative disease models that we've so heavily focused on. But I think, I wonder if you have any thoughts on just that idea of prevention versus, shifting some of these old ways of thinking to be a little bit more focused on preventing disease and healthy aging, maintaining health, as opposed to kind of dealing with issues when you're kind of at a dire state. We have just a little bit more time, so I'll kind of let you kind of finish off, and then we'll go to key messages.
Perfect. Right. This is such an important point, going for primary prevention, which is really trying to think about how we can promote healthy aging, psychological well-being, and prevent or postpone at least the development of chronic disease and different conditions. And one example that comes to mind is in the city of Santa Monica in California. They have this City of Wellbeing, this initiative, and this is really nice primary prevention efforts. So the city is really investing, how can we promote and support well-being, and well-being is largely defined. So it's not only psychological well-being, but also social well-being. So they have different activities, a lot of volunteering activities where people can engage and give back to the community. So we're really thinking about primary prevention, supporting the community, bring people together to benefit the community itself, but also mental and physical health of the citizens, So that's a great example that comes to mind that could be used elsewhere.
Thank you so much. We're about to kind of wrap up and go to key messages. We have about 10 minutes to the hour. So I'll just thank everyone for such an active comment in the chat, as well as everybody who came forward to pose a question. At this stage, I'll introduce our speaker for next week's Global Cafe. So again, we're here every Friday. So next week, we'll be speaking about the importance of socioeconomic inequalities on hearing health in later life with Dr. Dalia Simpera. So I hope everyone on the line will be available to join us next week. So at this point, Dr. Trudel-Fitzgerald, I'll pass it back over to you to just give some final key messages.
Sure, thank you. So we've been talking about really different ways of thinking about the social environment, the structure of your social network, the social support, the quality of those relationships. And it's probably a blend that is optimal, right? Having a couple of different relationships that are nourishing and you don't feel lonely. And we know that these different characteristics of the social environment is good not only for mental health, but there is increasing research showing that it's good for longevity, for living longer, but also living healthier over time. And we suspect that these effects go through different mechanisms. So there are different explanations for these relationships. And among them, potentially people who are more socially integrated, they have better lifestyle, better health behaviors. They are probably better equipped to cope with stressors. So they have different ways of handling stressors. They have a more positive perspective on life, better sense of purpose, for instance. And we think that it also goes under the skin. So if you have a good social network, you feel less lonely, it's probably good for your blood pressure and maybe less inflammation that over time is good for health. And we talked a lot about how we can promote social network, and there are ways that can be done at the individual level, being creative during the pandemic, but also some options at the broader, more higher level in terms of public health policies. So I think in different way we can promote social integration, better social network, and more nourishing relationships to live a longer and healthier life. So I want to thank you everyone for being here. I was about to say this morning, but regardless of your time zone, and if you're interested, we have Facebook and Twitter webpage of the lab. So I can circulate that information to put on the website, but it's at FitzLab UQTR. It's going to be written, but I'm happy to follow up on this conversation. Thank you for being here.
Thank you so much for joining us at the Global Cafe and providing such a great overview of your work. And I'm sure everyone will be happy to kind of receive any more resources that you have to give. And such an important topic, especially following COVID-19. And so I think we're all a little bit more aware of the impact of social integration. I think we can all take a couple of little tips here and there as well in your own personal life. That's kind of one of the nice things about this topic, is that it's so personal in so many ways, and people can relate so personally to it. So I have to thank you so much for your time. And again, to everyone on the call, as well as to Bruna and Luana, who work to make the Global Cafe kind of happen every week. And we'll see you hopefully all again next week.